In this video, I'm going to discuss a wrist flexor strain and what you can do to try to progress yourself out of that pain and back to functional use of your hand. What is a flexor mass strain? So the flexor mass is on the inside of the elbow here, most commonly associated when someone has golfer's elbow, that irritation over here. It's going to be on the inside here of the forearm of the elbow. You may notice an increase of pain when you flex the wrist down this position. If you grab a hold of something, you squeeze that, you're going to feel that in this area. A whole bunch of different reasons can cause this. It could be something traumatic. It could be from repetitive strain, just overuse. I've seen a lot of different cases or causes of this. And a lot of times the patient, they use those braces or straps. So you start with that. Maybe they're using a topical cream, some sort of, anti-inflammatories, all those types of things. And then we have to get back to moving and loading that tissue. So that acute phase, that phase 1, is going to be where everything is really inflamed. It's just recently happened. Maybe you're still using ice. Maybe you've progressed onto heat. A lot of people ask, do I use ice or do I use heat? Honestly, you're going to get a lot of opinions on that. I tell patients whatever feels the best. After the first 24 to 48 hours of maybe icing, I would go over to heat in a lot of cases just to improve blood flow. I'm okay with that. Again, that's just preference. Some people like to stay with the ice. And you're also going to work on stretching. So we're going to bring the wrist back into extension here. So I'm pulling my wrist back. I'm going to feel that stretch through here. I don't get too aggressive with it at first. Maybe I can only pull it back a little bit, and that's okay. I'm going to hold that for around 20 to 30 seconds. I repeat that for a couple of repetitions, and that's something I'm going to do all throughout the day. So whenever I think about it, I'm going to go through a little bit of stretch here, hold that stretch, and then relax. So I'm going to start with that stretch definitely, and that's something I'm going to do all throughout all 3 phases. I'm really going to focus on it on that first phase as much as possible. And then we're going to progress into strengthening exercises. We need to load this tissue. Now, it's not just strengthening, but it's also loading the tissue to promote adequate collagen fiber or scar fiber healing. So we want to go through those exercises using a simple dumbbell, or you can use one of those exercise bands, which we're going to demonstrate. So initially you want to use a light dumbbell, something that's not overstraining or too stressful to the tissue. This dumbbell is going to be 3 pounds. So what we're going to do is I'm going to rest my forearm on this pad. You can roll up a towel or a small pillow, whatever you have. And I'm going to go into wrist flexion. So you're going to flex in this position. You're going to see that and feel that on the inside portion here of your arm. I'm going to go into that. Repeat that for 2 to 3 sets of 10 to 15 repetitions. And initially I would do that once a day. And after that first 7 to 10 days, I'm going to start doing that twice a day if I can tolerate it. So that's wrist flexion. Then we're going to work on supination and pronation. So I'm going to hold the bottom of that same dumbbell. I'm going to flip over palm side up and then work back over palm side down, because this is that pronator teres muscle here that comes into that flexor mass. So we want to work that area. The same repetitions, 2 to 3 sets, 10 to 15 repetitions. Initially start once a day and then work up to twice a day. If you want to use one of these exercise bands, you can do that as well. So I'm going to take the band, put it across my palm here. You can go out to the ends of the fingers if you'd like, just whatever feels most comfortable to you. I'm going to pull down so I have resistance, and I'm going to work on that wrist flexion just as I was doing with a dumbbell. It's not as, I would say, it's a little difficult sometimes with the band, not as smooth as using that dumbbell. But if you don't have a dumbbell, you can just use a band to do that and go into flexion. You can grab it like this if you'd like and go into flexion. And then you also can work on that supination and pronation. So what you would do is my forearm here is in neutral. I'm going to take the band across here and I'm going to work on rotating palm down, and that works that pronator teres muscle. Same as the dumbbells, you're going to do that for 2 to 3 sets, 10 to 15 repetitions. Our last thing we're going to do in that first phase is going to be to work on grip strengthening or loading those tendons again that's coming off of this area. When you use one of these hand grippers or hand strengthening exercise devices, this one's by Alpha Grips. I really like this one. I'll put a link for this in the description. And you're just going to work on, just like that, working on bringing the fingers down, making a gross fist. You're going to feel that in the forearm. And that's something I complete for 2 to 3 sets, 10 to 15 repetitions. Just like the other exercises, start once a day and eventually progress to twice a day if you can. In phase 2, we're going to continue with those same exercises and that stretch that we were doing in phase 1. We're just going to add in a few heavier components to really stress the tissue. What you're going to do is just a bicep curl, and you have 2 options here. You can start off with the palm facing your body, and you rotate up as you come up, and then rotate back down so my palm is facing towards my body. or I can start my palm facing up and just come straight up and down, just like that. That's fine either way. It doesn't really matter to me. Some people, they say it feels better one way versus the other way. Whichever feels the best to you. You're going to complete 2 to 3 sets of 10 to 15 repetitions with that exercise. Next, we're going to go into static holds. So what you're going to do is you're going to, that bicep curl, you're going to bring your elbow into this position. It doesn't have to be exactly at 90 degrees. You're just going to hold that, keep the wrist nice and straight, and you're going to feel that on the inside of the elbow. You're just going to statically hold that. I'm working towards maybe holding this for 10 to 15 seconds, just trying to build some endurance within the muscle tissue, and then I'm going to relax. Then I'm going to repeat that again, statically hold that, 10 to 15 seconds, and then relax again. With that exercise, I may only complete one set of 10 repetitions versus the 2 to 3 sets because that can be a little taxing on the tissue. So I don't want to overdo it and over irritate the area. I just want to build that capacity for a workload in that tissue. Then we're going to work on a static hold in this position with the arm out. Now you can put the arm straight out in front. You can put it out to the side. It doesn't really matter, just whatever feels the best to you. What I'm really trying to work is this flexor carpi radialis muscle. So this muscle runs from the inside of the elbow, runs down on the thumb side here. And if you'll notice, I'm not holding my palm in a completely neutral position. I'm going to rotate it out just a little bit. So it's a little bit rotated out. My palm is rotated just a little. I'm going to hold that and really feel that through here. I'm also going to feel on this top side over here. That's okay. But I want to hold it in this position, again working towards 5 to 10 seconds for around one set of 10 repetitions. Another thing we want to work on in that phase 2, we're going to start working on a little bit of cross fiber friction massage or scar massage. And I'm going to use one of these scraping tools. You don't have to use one of these, but if you do, there's a whole bunch of different kinds that you can use, different materials. It doesn't really matter to me because you're just going to kind of be easy. And I'm going to go all over this area a little bit and different directions. I can go from the elbow towards the hand and back and forth. I can go across, and that's going to be more of a true cross fiber because the fibers are running this way. You know, it's called cross fiber friction massage, but in reality, I just really like to go all directions because I also like to use this for that kinesthetic awareness, right? We had damaged tissue, so we're going to provide that kinesthetic awareness. So I might not just stay right in this area. I might work all the way down to my wrists and all the way back up. Usually feels pretty good. Just be a little careful because you do have the ulnar nerve that runs through here. So you don't want to irritate that ulnar nerve and kind of get that stirred up. And I spend maybe 60 seconds to 2 minutes. I do that a couple times a day. But remember, we don't want to do this in the first phase. We want to wait to that second phase. Typically, the second phase for me usually happens at about 2 weeks. It just depends on how you're feeling. I may push that a little farther out, but a lot of times within 2 weeks, I like to start these exercises that we're doing in phase 2. Phase 3 is going to be basically returning back to your normal daily workouts if you go to the gym or if you're just at work, your normal work routines and tasks. Those are the things you're going to go back to doing, throwing a baseball, softball, whatever. And that usually I will spend in phase 2, I'm going to spend a couple of weeks and maybe 3 weeks, 2 to 3 weeks, it just depends. And then I'm going into phase 3. I realize not everybody has that kind of time to maybe take off work or take off from your sport. But that, for me, that just seems to work the best. So I'm going to go into that and then just kind of continue with those stretches and those exercises that we've been doing in those first 2 phases. And I may continue those exercises for another 2 to 3 weeks just to make sure that everything is functioning like it should. I hope this video helps with that wrist flexor strain here so that you can return to sport, work, and life. Thanks so much.